Let's turn to health matters. The federal government and supporting partners have launched a pioneer project which aims to establish a framework for Nigeria to effectively identify and reach zero-dose children in communities. The first phase of the project will be implemented in states like Sokoto, Kano, Bauchi and Borno. And health correspondent Kemi Balogun has details.
Despite the progress made in increasing access to immunization, many children still remain without basic routine vaccination. In 2017, the federal government took the step to address this lack within the country by declaring an emergency on routine immunization due to a Penta 3 coverage rate of only 33%. After 5 years, there was a gradual upward shift with a 57% increase on the Penta 3 coverage rate. This national launch of the Gavi Zero Dose Learning Hub, which has been tagged the greatest catch-up campaign of all generations, is expected to change this by ensuring that no child is left vulnerable to vaccine-preventable diseases.
Consequently, a significant portion of our eligible population, particularly children, remain susceptible to vaccine-preventable diseases. These children are often referred to, as you heard earlier, as zero-dose individuals.
It's really evidence generation, evidence synthesis to improve programming, to improve the practice. The country learning hubs is initiative in 4 countries. Nigeria is the 4th and the last to launch.
A strategic priority of the World Health Organization's Immunization 2030 agenda is to reach zero-dose children with a target to see a 50% reduction. And these experts believe this can be done.
ED emphasized the immunity gaps, the diphtheria outbreaks, and the broader implications of those. It's not just about the outbreak, it's the underlying causes of these outbreaks. So meaning, there's actually a need for us to think about doing something different. And so that's why the concept of the learning hub, I think, gives us hope of something new.
We envision this learning hub to become the cornerstone of our progress in routine immunization.
The nation has emerged from the COVID-19 crisis with a renewed determination and innovative approach to fortify the nation's immunization system. Kemi Balogun, TVC News, Abuja.
And I have joining me the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib. He joins us live from Abuja. Good to have you join us. So, Dr. Faisal, I'm very sure that a lot of people will be surprised to hear that there are children who have not had any kind of vaccination or immunization whatsoever. Talk to us about that and the challenges you face in that regard.
Yeah, thank you very much for that question. So in the course of the last few years, we've started from a situation where only about 33% of kids had DPT-3 coverage to a gradual improvement, like you saw in the reporting, to 57%. But that is not the whole story. From 33%, we gradually increased to 57% in 2018. In 2019, we hit heights of 71% in terms of coverage. But because of COVID-19 pandemic, a lot of parents did not have the opportunity to take kids for vaccination. So there was reduced access to routine immunization. This is one of the reasons why we've had an accumulation of kids that have not had vaccines for quite some time. But apart from that, this was adding to a layer of some places where the culture of parents taking kids to for vaccinations had not been established. So there's a background of that, and then the COVID-19 made it worse. Now we have up to 2.2 million kids that have never had vaccination. And this is why we've had to launch the Zero Dose Learning Hub to understand better how we can use strategies, use evidence to improve routine immunization coverage. And all hands are on deck because President Bola Ahmed Tinubu and the coordinating Minister of Health and Social Welfare are very clear about the fact that no child can be left behind, no child must be left behind in access to life-saving vaccines. So we must bring equity, inclusivity, and transparency in our operations. This is why we are prioritizing making sure that every single child in Nigeria gets the vaccine that they need. But first, we must understand why, after several decades, we continue to see kids that have not had access to vaccination. So we don't want to be flying blind anymore. We want the evidence to show what we should do. What is it that we're doing right? What is it that we're not doing right? This is what this learning hub is going to teach us.
And I want to get to this new project in just a moment, but I also want to ask you, because you mentioned the COVID-19 pandemic. We saw the misinformation and the conspiracy theories that followed that pandemic, especially the vaccination. Did that sort of spill over to immunization? Do you hear parents say, look, we do not trust where this is coming from, just as a spillover of that conspiracy theory?
Yes, one of the drawbacks, of course, is that when you start with narratives around the side effects and of any vaccine, it has a spillover on other vaccines. So those that generated false information about the harmful effects of COVID-19, of course, ended up deterring parents from wanting to take their kids for vaccinations, because not only did they disparage the COVID-19 vaccination, a lot of them totally disparaged vaccination as a whole. And we all know from evidence that vaccination is the single most important public health intervention that we've ever seen. Vaccination has saved several billions of lives of kids under 5. So yes, the misinformation and disinformation around the COVID era also contributed to kids not getting the vaccines that they need. So it wasn't just about access, but also the fact that people became discouraged. So we no longer saw situations where women in the rural area will walk for 2-3 kilometers just to get their kids vaccinated, because every mother wants to protect their child. And if people are sending the false narrative that vaccines actually harm the kids, then of course they become ambivalent, and then to some extent they become non-compliant. So all of these factors is what has contributed, to this pooling of kids that have not had the vaccines that they need.
And so talk to us about this latest strategy and framework to effectively identify and reach zero-dose children.
So we're not satisfied with just 57% of kids having access to vaccines. We want to reach heights of up to 90%, right? Yes, the benchmark may be 80%. We know that with the capacity that Nigerians have, with the resources that we have, and of course, under the leadership of Mr. President, there's a renewed hope, there's a renewed agenda to make sure that Nigerians get better quality healthcare. This is why we're pulling together our partners, our donors, to come about with this innovative approach to making sure that we identify, we measure, we monitor, and reach every single zero-dose child and community so that they have access to the vaccines that have been proven to make a difference in terms of preventing against vaccine-preventable diseases. So now we're looking at how we can go to those communities that are far-flung, communities that are separated by bodies of water, right? In places like the Niger Delta, kids that live in mountainous areas, kids that live very far away from health facilities. So even as weak as our primary healthcare systems are due to a lack of human resources, infrastructure, equipment, and commodities, but still making sure that we take vaccines as close as possible to where people live and work, identify where these kids are, making sure that we deploy hardworking health workers, frontline health workers, to get to take vaccines to them. That is sort of where we're driving at. And why do we believe that we can get this done? Because we believe in the power of science, the strength of our community, and the spirit of resilience.
And just from what you were saying, Dr. Faisal, a child who is not vaccinated, is at a risk not just for that particular disease, but every other disease, and puts every other children at risk. Thank you so much for talking to us, and we wish you all the best in these efforts to keep children safe. the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib.